Hello everyone, my name is Maria Petrova and I am from Group 1. Our group consists of 6 people and the topic we choose to present is mental health. What is mental health? Mental health is a state of psychological and emotional well-being. It affects our thoughts, behavior, and physical health. Mental health is not simply good or bad. It exists on a spectrum, which means it can change over time depending on a person's life experience and circumstances. Good mental health is associated with self-confidence, balance, inner peace, positive thinking, believing in yourself, motivation, and calmness. Poor mental health can lead to problems such as depression, anxiety, addiction, and social isolation. Thank you very much.
My name is Mohammad Reza Islami Mofidabad. You can call me Mo, and I'm following Maria. I want to talk about slide 3, why mental health is important. You may ask, why is the mental health so important? The answer is that mental health affects both our mind and our body. Poor mental health is linked to physical health problem and can even reduce life expectancy. Good mental health also help us study, work, build a healthy relationship, and enjoy daily life. When mental health problem are not treated, they also increase pressure on health care service such as the NHS. That is why early recognition is so important. And slide 4 about common mental health disorders. Now let's look at some common mental health disorders. Anxiety disorders are among the most common mental health condition in the UK. Depression involves feeling sad for a long time and losing interest in activities and that people usually enjoy. Another common condition is obsessive compulsive disorder or OCD. People with OCD experience unwanted thoughts that lead them to repeat certain behaviors. It is also important to remember that some people experience more than one mental health disorder at the same time, which can make diagnosis and treatment more difficult.
Hello everyone, my name is Ashita Menon, student ID S344520. Taking over from what my colleague Mofid has talked about the common mental health disorders, I'd like to now talk about the causes and the risk factors of mental health. So what is it that brings these type of conditions about in the first place? according to the NHS in England, it's a combination of all of these factors: biological, physiological, biological, psychological, and also social, all in one. There's also a genetic component, and if someone in the family has had it in the past, then you're a little more prone to having it. Adverse childhood events and trauma are also highly important risk factors. Life experiences actually have a very high mental impact on mental health, and also moving into childhood. The Mental Health Foundation state that there is a good correlation between poorer mental health and socioeconomic deprivation. So financial difficulties also play a part. Let's talk about the signs and the symptoms of poor mental health. So what are the ways in which we can recognize that you're having trouble? Changes in your mood, in sleep, in your appetite are serious indicators that you are having mental issues. It can be difficult to concentrate properly or even make fairly simple decisions, and the NHS in England also notes that physical symptoms such as persistent fatigue and unexplainable aches and pains can also be closely related to a person's mental health. Mental health impact on your everyday life. Well, how does it all fit into a person's life? Mental health problems can also have an actual impact on a person's ability to perform at work or school. He or she may have decreased ability to concentrate and to focus on things. It can also be a strain in the family and friends relationships. The person may find himself or herself distancing themselves, or just going into isolation for long periods of time. Even the simplest normal things you have to do, such as taking care of yourself or simply going through an average day, would be extremely exhausting and overwhelming for somebody suffering with a mental disorder. If this goes on for an extended period of time, then without having any support put in place, then it can eventually cause social isolation and true loss of independence, something any of us would like to avoid if possible. Thank you very much. Thank you.
Hello everyone, my name is Phyllis Bulbul, and my student number is S346326. And now I'll be discussing the mental health of students and young people. This topic is particularly relevant because many of us are students ourselves, so we can understand some of the pressures that come with education. Over the last few years, there has been a significant increase in anxiety, depression, and other mental health difficulties among students across the UK. According to Student Minds in 2025, more students than ever are reporting poor mental health and seeking support. This has become a growing public health concern because mental health doesn't just affect emotional well-being, it can also impact education, relationships, physical health, and future opportunities. There are several reasons why students are experiencing higher levels of mental health problems. One of the biggest factors is academic pressure. Many students feel stressed by deadlines, coursework, examinations, and the expectation to achieve high grades. Alongside this, financial pressures such as tuition fees, the rising cost of living, accommodation costs, and balancing part-time work with student work while studying can add even more stress to the situation. Social changes are another important factor. Starting college or university means moving away from home, leaving family and friends behind, and adapting to a completely new environment. While this can be exciting, it can also make students become overwhelmed and feel lonely. Some students may struggle to find new friends and feel isolated, and particularly if they don't have a strong support network. NHS England also highlights that the increasing demand for mental health services is having a disproportionate impact on young people. More people are asking for help than ever before, meaning services are becoming increasingly stretched and waiting times can sometimes be longer. This can make it difficult for students to receive support when they first need. However, there is positive evidence that early intervention can make a significant difference. When schools, colleges, and universities recognize the early signs of mental health problems and provide timely support, students are more likely to stay engaged with their education, improve their well-being, and achieve better academic outcomes. Early intervention can also prevent problems from becoming more severe in the future. This highlights why raising awareness, reducing stigma, and encouraging people to seek help early are very important. Moving on, I would like to talk about slide 9, ways to maintain good mental health. I would now like to discuss some practical ways people can maintain good mental health. The first is regular physical activity, as much as all of us know. Research from Mind shows that exercise is strongly linked to better mood and emotional well-being. Physical activity releases endorphins, which are natural chemicals that help reduce stress and improve happiness. The exercise doesn't need to be intense. Even short daily walks, cycling, or stretching can have a positive impact on mental health. Another important factor is maintaining social connections, having supportive relationships with family and friends, or even classmates. It helps reduce loneliness and provides emotional support during difficult times. Simply talking to someone you trust can make you feel more manageable and remind people that they are not facing challenges alone. Good sleep and balanced nutrition are also essential. Sleep allows both the body and the brain to recover, while a healthy diet provides the nutrients needed for normal brain function. Poor sleep and unhealthy eating habits can increase stress, reduce concentration, and negatively affect your mood. Therefore, maintaining a healthy lifestyle supports both physical and mental well-being. Mindfulness and stress management techniques are also recommended by the Mental Health Foundation. Activities such as meditation, deep breathing, yoga, or simply taking a few minutes each day to relax can help people manage stress more effectively. These techniques encourage individuals to focus on the present moment, reduce anxiety, and build resilience when facing challenges. It's also important to recognize when professional help may be needed. Looking after mental health isn't only about preventing problems, it's also about knowing when to speak to a GP or seek help from a counselor or mental health professional if someone is struggling. Overall, maintaining good mental health involves a combination of healthy lifestyle choices, supportive relationships, and seeking help when necessary. By taking small but consistent steps, individuals can improve their well-being, reduce the risk of developing more serious mental health difficulties. That concludes my section of the presentation on students' mental health and ways to maintain good mental well-being. I'll now hand over to the next speaker, who will discuss the treatment and support available for people experiencing mental health difficulties. Thank you.
Hello friends, my name is Dorothy. Topic: treatment and support available and how friends and family can help. Mental health treatments combine professional clinical care with community support. Effective clinical strategies include physiological therapies and medication. Crucially, the active engagement of friends and family significantly enhance patient outcomes and reducing relapses and shortening hospital stay. Clinical treatments. Under clinical treatments, we have physiological therapy, pharmacological intervention, and integrated care. A combination of both therapy and medication often yields the most effective result for long-term symptoms management and recovery. References: National Health Service 2026 and World Health Organization 2023. How friends and family can help. Friends and family can help in many ways by providing emotional support, simple listening without judgment, and spending quality time with loved ones help reduce feelings of isolation. Reference: Mind 2024. They also help by signposting professional help. Friends and family play a vital role in encouraging the individual to reach out to community mental health team and primary care providers. References: National Health Service 2006 and National Institution for Health and Care 2023. By effective mental health treatment, recovery relies on professional treatments, the continuous support of friends, and friends remain vital for long-term success. Thank you.
Hello, my name is Elsa Paiva, and after Dorothy's slice, I'm gonna talk about reducing stigma around mental health. Before you go on, let's have a quick discussion about stigma. It is indeed a significant obstacle for many, but stigma is still one of the biggest barriers to people really getting the help they deserve, as well as being afraid of being judged, misunderstood, or treated differently. However, over time things are slowly changing, and this is mainly due to awareness campaigns which have over time helped to change attitudes. That's why it is always important to normalize help-seeking behaviors within workplace and educational environments. The more open we can be about mental health, the less is intimidating and taboo to everyone who is involved. And NHS England is emphatic that health and social care professionals have a significant part to play in this, through challenge discrimination attitudes if and when they are come up in practice. To conclude, with that being said, the importance of mental health is just as significant as physical health, period, and is indeed a fundamental element of good, effect health and the social care practice in general. When you are able to recognize and identify the issue early, provide support that is tailored to their needs, and where there is a true reduction in stigma, then outcomes are definitely better for everyone involved, not just the individual. As Mind reminds us so clear, practitioners really do need to take a person-centered approach to their work and see people as unique individuals with their own story, rather than just to reduce them down to symptoms or a diagnosis or on a page. We are so grateful to have had to everyone to listen our story today. Thank you for listening. Bye.